you can hear that the pilot sites have really been working really hard, and it's amazing that they've been doing all different projects. And our final site, Stevenage, it's lovely to introduce Alex Scaletta on behalf of their project looking at preemptive transplant. Thanks, Alex.
Hello, good afternoon, everyone. Thanks to everyone for joining. A lot of tough acts to follow, but I'll give it a go. My name's Alex Scaletta. I'm one of the nurses leading for the Advanced Kidney Care team at the Lister Hospital, and I'm just here to present our one-year update for our Transform AKC project for preemptive transplantation. So at the moment, our catchment area is about 1.5 million. We have about 609 patients in the Advanced Kidney Care team, including 127 patients under conservative management. Where we differ is we have 5 separate AKC clinics amongst 4 separate trusts. We also operate with 2 separate integrated care bodies and refer to 3 separate transplant centres. So as you can imagine, while we're able to offer our service to a large geographic area, working across 4 different trusts and multiple transplant centres can be quite a complex process to navigate. So our focus is on preemptive transplantation. As of November 2024, only about 9% of our AKC patients with an eGFR of 20% or below were active on the transplant list. So suitable patients should be activated on a transplant list within at least 6 months of anticipated starting of renal replacement therapy. And we would hope that discussions around transplantation would start when a patient has an estimated eGFR of about 20% or below. Now, at one of our previous conferences, our lead AKC consultant asked the audience if they were to have renal failure, would they be interested in receiving a transplant before starting dialysis? And almost everyone raised their hands, highlighting a strong preference for preemptive transplantation. This has kind of further emphasized our drive to increase our preemptive transplant numbers moving forward. Next slide, please. I skipped again, so one more, please. So our goal for preemptive transplant listing is to ensure that at least 25% of our patients in AKC are placed on a potential transplant pathway. So this target is for patients with an eGFR of 15% or below, with the aim of progressing them towards activation on the transplant list. This number currently excludes comms care patients and patients that are classed as not listed permanent. So there may be additional patients waiting for certain investigations to be carried out. We may want to be waiting on prior to activation, but this will allow us to make sure that these patients are properly monitored. Next slide, please. So the process so far, with the support of Ranjit and Julie from KQuit, we've looked at the process mapping for our transplant assessment pathway. So we were able to look at key steps and then started to look at what problems there were and identify any possible ideas for change. We have engaged with key stakeholders that include LACPA. We've also been able to engage with interested patients within the service and LACPA to get their perspective and input. And I'd just like to thank Tarzan and the LACPA team for their involvement with our projects. So we recently had a great opportunity to interview a group of AKC patients currently on the transplant pathway, all of whom shared their personal experiences. Their feedback was valuable in identifying areas of the pathway that we could be improving upon. And we've also engaged with different trusts which we are spread over across all the different clinics, so they know of the progress being made and what's going on. And we also have monthly measurement updates to see how we're progressing. Next slide. So the first area we needed to work on was to accurately record our patients' transplant statuses. So we used an electronic patient record called Clinical Vision. This was done by Dr. Fluck, our transplant consultant, and Claire, our transplant clinical nurse specialist. This was needed so we knew what we were dealing with, so we could better understand the scale of the issues, with aspects to which part of the pathway we needed to focus on. We also looked at revising our categories for patients that were not listed for the transplant on our system. This was needed so we had a bit more understanding of why a patient may not be listed to March 2025 when we started. We only just had about one data field for patients which were just listed as not for transplant. So we've worked quite hard at creating these different listings so we could separate the categories which have a clear understanding and reason of why a patient may not be listed. This could be due to BMI, vascular issues, urology, or patient choice. So the use of these separate listings has allowed us to better understand which parts of the pathway need to be worked on. Due to the fact that we work with 3 separate transplant centres, each area also has different policies and pathways. So to support our patients, one of our transplant nurses created a testing guide to better inform the renal doctors of what tests were needed depending on their chosen location. So this aims to reduce delays as the clinicians can be aware of which tests need to be requested earlier on to prevent delays. This is quite important as different test centres require different imaging. So this now allows us to request tests at the point of referral, opposed to delaying these requests until after our transplant nurse-led assessments. We also have a dedicated weight management clinic now, which is run by our dietitians. The aim of this will be to focus on AKC patients who are with a high BMI, which is a barrier to transplantation. So the dietitians are now receiving referrals, so we hope as time goes on this will lead to an increase in activations over the next few years. Lastly, we've reintroduced the patient information group day events on transplantation and home-based treatments. Through these sessions, we've identified a real need for peer support to be involved. Patients greatly benefit from hearing directly from those who have undergone transplantation, as it provides valuable insight and reassurance. In the past, discussions about transplantation typically took place during AKC clinics with doctors or as part of a renal replacement therapy conversations. Our current goal is to introduce this topic of transplantation much earlier on in the AKC journey. We've also recently held our 3rd patient information group day event to help us engage with patients much earlier on, and the feedback was overwhelmingly positive. And next slide, please. So this is just looking at some of our data. So this chart shows an updated transplant status category. So I don't know if you can see on the areas where we've got highlighted. We've got quite a few different groups, which is what's enabled us to better understand why a patient may not have been listed through their journey. The reason this data starts in March, though, is that the transplant team had to go through and review all of the AKC patients. This was quite a time-consuming process, but ultimately was very much worth it as it's given us a clearer understanding of our patients and the factors affecting their transplant status. At the moment, we've currently got about 14% of our patients on the list awaiting or active on the list compared to March. While this does show an improvement, it's a number we're keen to focus and improve upon. We have also successfully reduced our no data figures. This was quite a large amount of our patient group at the beginning, but through the tireless efforts of the transplant team, they've been able to really hone down and identify and go through each individual patient to kind of make sure we know exactly what's going on with them as well. And again, this was quite a time-consuming process, but it's allowed us to have much needed clarity. Next slide. So since March, the number of patients in the transplant pathway has increased from 41 to 48%, which is the progress we're aiming for. By introducing transplant discussions much earlier, we're engaging more actively with patients, encouraging them to consider this option. As a result, we anticipate further increases in referrals to the transplant pathway with the goal of progressing more patients towards activation. Next slide, please. Now, as you can see, these are our new not listed data fields. So as I previously mentioned, you can see that there's quite a lot more. We do aim to reduce this number moving forward. An example would be if a patient is not listed due to high BMI, we can refer them to the dietitians for weight management if they want to pursue this. Similarly, patients which may have been excluded for cardiac reasons may benefit from a referral to a cardiologist for further evaluation, such as angiograms or other treatments. With our earlier referral process, we're hoping to identify and address these issues sooner. Next slide, please. So it's one of those ones where you keep clicking and then you'll get the arrows. So this definitely shows that there's signs of improvement, but we've got a little way to go. As you can see from this at the beginning, we noticed a drop, which we attribute to having all of our patients properly coded and having their statuses documented properly. Since then, we've seen a steady improvement with overall numbers, which we believe will be helped with our information group day events. And we have noticed two kind of pivotal moments where we did see a sharp increase after those events as well. Next slide, please. Now, this is one of our more interesting slides. So as you can see from this, the previous 2 years, we did notice a small drop, which we unfortunately had to attribute down to staffing. We'd lost a full-time equivalent and had some staffing sickness. But as of October this year, we've seen a huge increase in the amount of referrals the transplant team are having. It's quite an impressive figure compared to the last 2 years, so we're quite excited to see what we can do to improve this number moving forward. Next slide, please. So ultimately, our aim is to still reach 25% by March. We still have a little way to go, but we're quite focused about the improvements being made already through the whole process. We're hoping that these numbers will improve as we continue. We're hoping that with the large amount of referrals, which you saw on the previous slide, one thing to note that slide also includes patients above 15%, but the earlier identification will allow us to hopefully have future activations as we move forward. Next slide, please. So next steps. So we're currently in the process of automating our systems for data collections through our IT systems called Clinical Vision. We're hoping that we'll be able to have generating real-time reports, which will help us identify barriers and reduce a lot of time-consuming admin. At the moment, we have to do and generate separate reports and collate the data and kind of put them together, but with the hopes in the future that we'll be able to just grab what we want. So an example which we could use is we could easily pull up all the data for everyone with an elevated BMI, and then this would allow us to generate a report which then gets sent to the dietitian so we can evaluate people who would potentially benefit from weight management clinics. We're also happy to see that the referrals are already starting to come through with the renal dietitians. So in about a year's time, we'll be quite interested to see how they progress with that. We're also engaging quite heavily with the cardiology teams across the separate sites. At the moment, if we want a patient to be investigated, to have scans, we have to refer them to a cardiologist who then have to see them before they send them off for scans. So we are in the process of trying to get our nephrologists access to be able to request certain tests without the need of being referred to cardiology, with the hopes that this will reduce the delays that are present. And lastly, we're planning to increase our face-to-face sessions and nurse clinics. So we've recently introduced a health promotion clinic for the advanced kidney care team. The aim of this one is to not only introduce the journey, but also bring up much earlier on the idea of transplantation and live donation, not to pressure them into it, but to at least make sure they're aware of it. We also want to allow more live donor education events from the transplant team. But our next focus will be more patient information group day events, but we want to do more frequent but smaller groups so that we can kind of work with the transplant team and the other services to kind of pinpoint earlier on and get more patient engagement with that one. We're also aiming to try and get some more peer support services involved in those more small mini sessions, as a lot of the feedback we're getting is there's a real thirst for patients to be involved in the process. This will strengthen the support system and provide real insight for patients navigating their transplant journey. Next slide. So just a huge thank you to the entire team for the hard work and dedication they put into this project. With the groundwork now firmly in place, we're excited to move forward and hope to see a nice increase in the numbers of patients activated on the transplant waiting list over the coming year. Thank you.
Thank you so much, Alex, and to the Stevenage team. You've achieved an incredible amount in such a short time. I think you're just getting started, so it'll be really exciting to hear what happens over the next 12 months, and hopefully you'll reach your goal of 25%.